or complex partial seizure, some students are confused, sleepy, or need time to rest, but others may recover more quickly and can stay in class. Recognizing seizures and performing first aid are ways to manage epilepsy in school.
Now we're going to talk about helping the teacher to help the child with epilepsy in the classroom. Some of the things that teachers can do to help the child is recommending those children for child study. Bringing a child to child study does not mean that they have an academic need necessarily at that specific time, but there's a potential for a need for intervention. There's two types of plans that we talk about. We talk about a 504 and an IEP. A 504 is a medical management plan that allows for some interventions in the classroom to help them be able to access education. For instance, if the child is using an outdated computer monitor that maybe has a flashing screen, bringing in a laptop monitor for that particular child can be of benefit. You don't have to adjust the curriculum, just the setting. Another thing is, allowing them to have a rest period if they need after a seizure, and that they would do that without being penalized, for instance, from a test. So they have a test scheduled that afternoon, they had a seizure that morning, they're going to go back to class, but maybe having that test moved to another time without penalty. Those are some things that can be added into the 504 plan. Also, if the child has a specialized diet, to be able to make some accommodations to teaching. For instance, in a science class, maybe they're talking about chemical reactions and they're making ice cream and they're talking about how that works. Well, a child that's on a ketogenic diet would not want to be taking in 4 cups of sugar and whole milk. Their carbohydrate count would be too high for their diet requirements. And so just talking with the teachers and letting them know that that's something that is a concern, you can very easily adjust that recipe by using whipping cream and Splenda, which yields the same result, but still allows the child to be in the learning environment and to do the same coursework that other children are doing. With an IEP falls under the special education umbrella, where they have to be found to be academically challenged. Now, they don't necessarily need to be in a special classroom. We can have honor students that have an IEP. It just depends on what their specific individualized need is. For instance, if a child were to need to have specialized tutoring or have a test given in a different way to reduce time constraints so that they can focus and not be so concerned, because often stress can bring on seizure activity, and having that implemented in the IEP can be very beneficial for the student and help them progress academically while not affecting their grade. Seizures and epilepsy would qualify under OHI, or other health impairment, and that would be the thing that you're looking at. Of course, they're going to be assessed by psychologists and social workers and everything else to see if there's anything that they would also qualify for instance, psychological disorders or another physical function. For instance, a child with cerebral palsy who also has a seizure disorder might be qualified under another part of the IEP. So that assessment takes place, and that's okay. But ultimately, if you have nowhere else to go, you can always utilize that OHI diagnosis for your 504 IEP programs. One of the big things that we want to make sure that we do is maintaining close communication with the parents. As teachers and nurses and even the students, the parents are there, they're going to these doctor's appointments. They know what the orders are, they know when the orders change, they know at home if they're seeing an increase or what the contributing factors are that can actually cause them to have a seizure, and having that close communication with them is very helpful. Email communication, telephone contact, sometimes just sending a note home in their binder saying, hey, this is what's coming up, and we just wanted to let you know that that's going on. If there's going to be a change in their day, they're having some extended testing coming up, those types of things, so that the parents can help the child prepare, which will help reduce their stress level and also potentially prevent any seizure activity during the school day. There's going to be kids that you can't prevent the seizure activity, and there's going to be children that have specialized medications or even equipment such as a vagal nerve stimulator that you're going to need to be trained for. Ask for that training, and if you are uncomfortable, make sure that you ask again. Not only is the school nurse responsible for giving you that training, but you are responsible for making sure that you understand it. So the teachers have a big responsibility with a child with epilepsy in the classroom, but it's not a responsibility that's not easily put into the classroom. Another good example that we talked about with some administrators was fire drills, and a lot of schools have implemented a strobe effect in the classrooms, which of course we know that strobes can often trigger epilepsy seizures. And so what can you do to keep the child in the classroom? Because you don't want to just pull them out every single time that they're going to have a fire alarm. So those children could potentially have a pack of earplugs and sunglasses that are in each classroom, or that they carry with them in their backpack. And they need to have a buddy in the classroom, and you need to have that buddy that knows how to advocate for that child as well. For instance, if they have a really good friend that the parent feels comfortable with providing some training to, and the student feels that they can do it, middle and high school is an excellent time for a buddy system where they can go, okay, well, my friend is not looking quite so well. Well, the teacher's got 30 other students in there to look at, and they can't necessarily see that child who may be having an absence seizure, but their friend might notice it and be able to bring attention to it so that that child can get assistance. There's lots of interventions you can brainstorm and get real creative in order to help the child with epilepsy in the classroom. But 504 and an IEP are one way that you can help provide an intervention to make them successful during the academic career.
Mallie P. Haynes has been a nurse for over 30 years at the Department of Neurology, dealing mainly with seizure patients.
Tips for supporting students with epilepsy: avoid overprotection and encourage independence. Include the student in as many activities as possible. Communicate with parents about the child's seizures, activity, behavior, and learning problems. Remember, we are all one team.
Well, as a parent and not just a school nurse, I come in contact with stuff like this every day. And one of the big things that I want to encourage you to do as a parent is advocate for your child. You know what their history has been, you know what their triggers are, or maybe you don't. Maybe you're new at this, but you will learn them. And you can provide useful insight to not only the teachers and the administrative staff, but also the school nurses. So you are an educator as well as them. When you come in, you want to make sure that you get as much information as possible to them. There is a really wonderful form that's in the seizure management CD that you can get from the school nurses that provides a history of your child's seizure disorder, and that can help them give a picture of what your child's seizures look like and how they act before and after a seizure, how long they've been going on, all those types of things that are very important for the school nurse to know. Don't be afraid to let those teachers know that your child has epilepsy. They need to know so that they can get appropriate treatment for your child in the event that they have a seizure during the school day. I know it's hard and you want to be a helicopter parent and just be there with your child. It's hard to bring that child to school, especially after that first diagnosis. But it's okay, and they're there, and there are medical personnel that can help, and those teachers, they're smart people. So you got to trust them and let them try to take care of your kids. One of the other things is maintaining close communication in the best interest of your child. You don't necessarily want to be argumentative with the teachers, compromising, looking to be creative and look for the things that can help your child. One of the things that we tell the teachers is that they need to talk to the parents. So one of the things that we want to make sure that we tell the parents is that you need to talk to the teachers. Email a lot of times is the best way to get in contact with teachers. They only have one planning period a day, so they can't always take all those phone calls. But if you have a concern that your child seems to not be doing so well on tests, maybe it's the testing format. You need to discuss, okay, well, they need to have the time taken away from that so that they can have a little bit longer time to complete their test. or maybe they need to have some tutoring sessions outside of the classroom in order to really grasp a concept that they're having a hard time struggling with, maybe related to the fact that they had some seizures that week, even at home when they're sleeping, those types of things, so that they can be able to progress academically the way that you hope that they will. Make sure that you're aware of any changes and report those to the school in a timely manner. If you're changing medications, you've got to get those orders in. If you are noticing an increase or even a decrease in seizure activity, you want to make sure that you let the schools know that you're seeing that, so that they can partner with you to provide the best education and medical care while your child is at school. Write a clear letter of what the child needs. As your child goes through school, you'll see some of the things that they need, for instance, untimed tests, or having break time, or having exemptions from particular science experiments, or those types of things in order for your child to be in school for the full day. Being excused for doctor's appointments and being able to make that work up in a timely fashion. How are you going to do that? If being able to communicate with both the teachers and the educational liaison in your epilepsy clinic, utilizing that as a reference point for you to be able to get what you need in the school. You can ask for a 504. You can ask for an IEP to have your child be brought to child study, and those are terms that in the lay world we're not really familiar with, but those teachers know what that child study is, and they will evaluate your child to determine if they need to have a written plan to help them be successful in the academic world. Also, document if the curriculum, school practices, or the teaching methods are hampering the student. So if you're finding that the teacher uses PowerPoints and your child has absence seizures and they're not able to visualize your child during the PowerPoint presentation, they don't know if they're getting that information or not. Maybe they need to make sure that they hand a copy of the slides to the student so that they can reorient themselves after the class is over, or a study partner that can note take for them, those types of things. You need to make sure that you're talking to the teachers about ways that you can better help your child during their school day, having a calendar of when things are due, and that way if the parent notes that a child is having an increased seizure activity and they've got a big test coming up, that's something that they can recognize, not only to bring the teacher and the school nurses, make them aware of that, but also to make the doctors aware that this is what you're seeing, an increase in activity related to some of these events that are coming up, and so that they can help you adjust the care of your child. Know your rights, and also know the school culture. In big cities, they throw the lawyer word around a lot, and advocacy and those types of things. And in small country schools and rural districts, they might not be as familiar as those other teachers and administrative staff. And so you're going to, once again, need to be the educator. You're going to need to let them know that your child has epilepsy, what they need in order to be successful in school, and that you're there to partner with them, that you're going to trust that whatever information you get to them, that they're going to be able to implement that. But you also need to be aware that you're going to have to stay on top of them, especially at the beginning, if they're not as familiar with how to control epilepsy in the classroom. I'll tell you that in the special education classrooms where they're confined, there's a much lower ratio. The aides are trained, those types of things. And so a lot of parents immediately think that maybe their student needs to go into the special education classroom, but that's not the least restrictive environment. You want to make sure that your child has a good social orientation to school, so that when they become an adult, they can meet with other people that both have seizure disorders or other chronic conditions and be able to talk freely about that, and also that they'll feel comfortable with their own bodies and not be ashamed of what's going on with them, so that they can be happy adults, which is what I think we all want for our kids.
I am here with epilepsy heroes Courtney Collins and Matthew Mays, and I'm going to ask them a few questions about epilepsy in school. And I'll start with Matthew. Matthew, how does peer pressure affect a person with epilepsy in school?
Well, for me, when I was in school, peer pressure was something I was afraid of, because I was afraid that if anyone knew that I had epilepsy, I would be treated differently, both by the students and the teachers as well. For example, when you're at a party where there's alcohol being consumed, instead of indulging in the consumption as well, you can just sort of carry around one beer and just not talk about it.
Courtney, could you tell us a little bit more about seizure triggers in the school?
There's lots of different types of triggers that you should try to avoid, such as strobe lights, which is an original one. Very strong smells, stress, and head trauma are things that you should really try to stay away from.
Matthew, memory is a problem for many people with epilepsy. How did you boost your memory in school?
This book that's put out by the Epilepsy Foundation of Virginia, Memories Are Made of This, has a lot of helpful tips. For me personally, I would often write things down in case I was afraid of forgetting them. I find it's easier to remember things if you can relate them to something that you already know. The acronym HOMES can be useful in remembering the Great Lakes.
Courtney, can you tell us a little bit about the buddy system?
I have an example. When I was in school, we were in class and I started spacing out. My best friend, India, actually starts tapping me on the shoulder, and she's looking at me in the face saying, Courtney, are you okay? She realizes that I'm not and goes and tells the teacher. She says, I've got to go get Courtney to the nurse now, and she takes me to the nurse so that we can get everything fixed.
Matthew, some of your family members participated in the Use a Helmet Prevent Epilepsy contest. Can you tell us a little bit more about it?
Every fourth grade class in Virginia participates, and the winners get their artwork published in the calendar that the Epilepsy Foundation of Virginia puts out annually. It's important to know why to use a helmet, because traumatic brain injury is the leading known cause of epilepsy in young children.
Courtney, you have told me epilepsy is not a joke. Could you elaborate?
One of my friends was at school while I wasn't and witnessed a few of the boys making fun of it, and she had to go over there and tell them to stop because it's not funny. Because it's really not. It's a really serious thing, and a lot of kids don't understand it, so they should really figure out what's going on and realize that it's not a joke and it's really serious.
Matthew, could you tell me more about your specific problems as a teenager with epilepsy in school?
As you know, stress can lower the threshold for seizures, as can a number of other things. And so that was something I was always concerned about as well.
Courtney, you like the EFVA puppet show. Can you tell us more about it?
This is our puppet Brian. He works with the Epilepsy Foundation of Virginia and goes to the elementary schools and shows the kids